The Finance Committee will come to order. Today, the committee meets to discuss two important healthcare nominations. Chiquita Brooks-LaSure has been nominated to serve as administrator for the Centers on Medicare and Medicaid Services, and Andrea is nominated to serve as Deputy Secretary of the Department of Health and Human Services. Ms. Brooks-LaSure has served at OMB, on the staff at Ways and Means at the Department of Health and Human Services, and she's worked in the private sector. She helped craft policies bringing down costs for older people. She helped to develop and pass key portions of the Affordable Care Act. She helped implement the law, and she worked hard to make sure that middle-class families shopping for private health options would get a fair shake thanks to strong consumer protections. Now, the Trump administration later undermined a lot of those protections, and that's created a host of new challenges for the committee and for the Biden administration. Ms. Brooks-LaSure is also very well versed in Medicaid policy, which is a hugely important part of this committee's responsibilities. She's worked closely with the federal government, states, and private organizations to expand coverage. Continuing on the theme of impeccable qualifications and experience, Ms. Palm is a proven healthcare agency leader who knows what it takes to run HHS in a smooth way. She previously served as the department's chief of staff and senior counselor to the secretary during the Obama administration. Most recently, she served as secretary designee of the Wisconsin Department of Health Services, a $12 billion agency. She's been the point person when it comes to COVID response in the state of Wisconsin. There, she led efforts to expand insurance coverage, improve mental health care, and reduce hunger. My bottom line is these are two individuals who are extraordinarily qualified for these essential positions and would be ready to go on day one after they're confirmed by the Senate. There's a lot of work to be done at HHS. Vaccinations are way up, but cases and deaths are still awfully high. Long, long way to go on the pandemic. Now, the committee is also going to keep working on other important health challenges, which I and other members have discussed with our nominees. For example, I have said that every single time this committee talks about federal health programs, we're going to be talking about updating the guarantee of Medicare. When I was coming up with the Gray Panthers, Medicare was an acute care program. You broke your ankle, it was Part A, you had a horrible case of the flu, then you went to the doctor, hospital for the broken ankle. Today, Medicare is cancer and diabetes and heart disease and strokes. And so many older Americans have two or more of these conditions. So this committee led the bipartisan passage of the Chronic Care Act in 2017. The Trump administration slow-walked the implementation. So I'm looking forward to working with both of our nominees to turn this situation around. Second, the rescue plan made a big down payment on mental health services. Senator Stabenow's worked tirelessly on this issue. And I was very pleased that now in the Medicaid program, for several years, we'll have the Cahoots program, which is a fresh and exciting model so that mental health professionals and law enforcement professionals are teaming up to deal with the tragedies we see on our streets that so often involve mental health needs. We're very proud that Oregon's been a pioneer, and I gather, based on reports, that the Oregon programs, their phones are ringing off the hook from around the country, from communities that want to copy what we've done. A special priority for us on the Finance Committee is dealing with the issue of inequality in federal health programs. We saw once again during the pandemic the results of healthcare disparities up close. Black, Latino, and Native Americans have suffered and died from COVID-19 at much higher rates. Now, it's not just about COVID-19. It's about maternal health, because women today are more likely to die in childbirth than their mothers were a generation ago. It is outrageous I say to our nominees and colleagues that in affluent white suburbs, there are all kinds of healthcare services of the most sophisticated nature. And in so many communities of color, it's like a healthcare desert. And this committee is determined to change that. Finally, we'll be working closely with all of you on the issue of lowering prescription drug costs. A lot of Americans feel they're just getting mugged when they go to the pharmacy counter, and we have concrete ideas for doing it. In addition to the question of the CAHOOTS program, there'll be other mental health issues. I'm very troubled about the fact that the parity law, which is supposed to give mental health and physical health the same treatment, seems to be honored too often in the breach rather than the observance. We'll talk to you about that as well. I want to thank both of you for being willing to do another stint in public service. We'll hear from Senator Crapo, our ranking member, also from the Pacific Northwest, and then we've got our colleagues here to introduce our nominees. Senator Crapo.
Thank you, Mr. Chairman. When we held our hearing for Javier Becerra to be Secretary of Health and Human Services, I noted the size and importance of the department he would lead. In normal times, HHS and its agencies provide healthcare service to nearly 150 million people, and those agencies affect the lives of many, many more on a daily basis. The COVID-19 pandemic has raised the salience of the department. The department's leadership, including the Deputy Secretary, will continue to play a key role in bringing us out of this public health emergency. Similarly, Medicare and Medicaid are providing essential health care to patients who have suffered disproportionately from the COVID-19 pandemic. Looking to the future, the Secretary, the Deputy Secretary, and the CMS Administrator must carefully evaluate how best to use resources available to them to promote the health of our citizens. They must do so carefully, constructively, and creatively. 2 months ago, I outlined several issues in the healthcare space where I intend to focus my efforts as ranking member, including fostering innovation to improve patient care and to make our healthcare system more efficient. The COVID-19 pandemic has threatened Americans' physical and economic health, but it has also reinforced the value of innovation and provided an opportunity to test changes that foster it. HHS has used this authority under the public health emergency to waive numerous requirements to ensure Medicare and Medicaid beneficiaries and other patients receive care during the pandemic. Patients and providers have benefited from expanded access to telehealth and expedited approval of COVID-19 vaccines, diagnostics, and treatments. Going forward, Medicare and Medicaid patients must have the same access to those innovative items and services as those with commercial insurance. We must carefully evaluate our response to the pandemic and implement appropriate reforms based on the lessons we've learned. HHS should partner with this committee in that effort. However, media reports about certain healthcare policies that may come before Congress or be enacted through executive actions are concerning to me. Some of these policies, such as including additional benefits under Medicare, could experience bipartisan support if considered through a transparent, cooperative, bipartisan process. Unfortunately, reconciliation does not afford Congress the opportunity to work together to evaluate these changes and make necessary reforms to protect the long-term financial viability of the program. Other policies, such as expanding Obamacare's premium subsidy to everyone, regardless of income, would be incredibly expensive for taxpayers without taking appropriate steps to lower the cost of health insurance. Creative bipartisan ideas to lower the cost of insurance in the individual market have been raised by states and my colleagues in this committee. I welcome the opportunity to work together on these ideas, such as allowing states to use waivers to their full potential, diversifying benefit designs, and incentivizing competition. Finally, I'm concerned about paying for some of these policies through changes in our drug pricing system that could stifle innovation. We can see the end of the COVID-19 pandemic approaching thanks to groundbreaking vaccines developed by pharmaceutical manufacturers. In this crisis, Industry responded to the nation's call to arms, codenamed Project Warp Speed, developing powerful and effective vaccines in record time. This success was possible because of the private sector. I strongly agree with my colleagues that this innovation is only valuable if patients can afford it. We should establish an out-of-pocket spending cap and reform Medicare Part D with the market-based principles of competition and transparency in mind. Ms. Palm and Ms. Brooks-LaSure, if you are confirmed, I look forward to working with you to improve our healthcare system. I ask you to commit to careful assessments of the risks and considerations in every policy decision you make. Political pressures possibly make unilateral action seem attractive. But you should also consider how the market, individual choice, public policy, and incentives play vital roles in development and delivery of healthcare. I look forward to hearing your testimony and your responses to questions. These positions to which you have been nominated have substantial influence over policy. The members of this committee need to understand how you will implement the administration's agenda. And we expect your answers here and in response to the QFRs to be detailed and candid. I look forward to the opportunity to visit with you today. Thank you, Mr. Chairman.
Thank you, Senator Crapo. Our nominees have the good fortune of being introduced by two senators with a long history of healthcare advocacy. And we will start with Senator Baldwin, who will introduce Ms. Palm, and then we will go with Senator Menendez, who will introduce Ms. Brooks-LaSure. Senator Baldwin.
Thank you, Chairman Wyden and Ranking Member Crapo, for holding this hearing. And I am honored to be here today to introduce Andrea Palm, President Biden's nominee for Deputy Secretary of Health and Human Services. More than 2 years ago, Governor Tony Evers selected Andrea Palm to serve as Secretary of the Wisconsin Department of Health Services. I met with her very soon after that announcement and was immediately struck with her expert understanding of health policy landscape, as well as her keen interest in building relationships with stakeholders from across our state. Her prior experience as a senior counselor to HHS Secretary Burwell and as a senior advisor on White House Domestic Policy Council provided her with strong qualifications to serve our state. With this foundation of experience, Andrea Palm delivered leadership to Wisconsin during the COVID-19 pandemic, and she built an effective response to the public health crisis we faced in our state, including her efforts to build a testing, contact tracing, and vaccination infrastructure in the state of Wisconsin. Andrea's nomination as Wisconsin DHS Secretary, like other nominations from our governor, was politicized from the beginning by the Republican-controlled Wisconsin State Legislature. It's true they held up her nomination for months during an unprecedented global health crisis. It's also true that the state legislature refused to convene for more than 9 months and instead sought to limit the power of the governor and other public health leaders, even as Wisconsin was experiencing one of the worst COVID-19 outbreaks in the country. Despite these barriers, Andrea Palm led and put the people of Wisconsin ahead of state capitol politics. In the face of consistent and constant political bickering and obstruction, Andrea Palm stayed the course and lived up to our state motto, forward. She made every possible effort to collaborate with stakeholders and trusted messengers throughout the state to protect Wisconsinites and provide them with the information needed to protect themselves and their families. And most importantly, Andrea provided leadership in Wisconsin that was always focused on science, public health, and the idea that we are all in this together. Because of Andrea's leadership, Wisconsin has maintained one of the fastest vaccination rates in the country. She set us up for success in Wisconsin as a national leader in getting people vaccinated quickly and I give her a tremendous amount of credit for where we are today, because she helped put the partnerships in place that we have used to get shots in people's arms and to protect public health. She also worked to ensure robust data transparency since the very beginning of the pandemic, which continues to inform our vaccine rollout and help us reach underserved communities. And in rural areas of Wisconsin, residents are getting vaccinated as quickly and as easily as residents in urban areas, a direct result of her focus on building relationships with stakeholders across our state. Having Andrea back at HHS will be a tremendous benefit for the department and all of our states, because she understands the urgent need to beat this pandemic and ensure the health and safety of all Americans. Andrea, welcome back to the Senate, and thank you for your service to the state of Wisconsin. Your hard work has always enabled you to meet and overcome challenges, and I look forward to seeing you confirmed as Deputy Secretary of Health and Human Services.
Senator Baldwin, thank you, and you are always welcome in this committee. Senator Menendez.
Well, thank you, Mr. Chairman, and there are many reasons we want to finally beat this pandemic. The health and welfare of our families, our neighbors, our fellow Americans. And because after 16 years I had finally worked my way down this dais close to Senator Stabenow, I'm hoping that we can get to that point, that we can get there again. Mr. Chairman, Ranking Member Crapo, and fellow members of the Senate Finance Committee, today I have the pleasure of introducing you to Ms. Chiquita Brooks-LaSure, President Biden's nominee to lead the Center for Medicare and Medicaid Services. And I must admit, I was thrilled to learn of Ms. Brooks-LaSure's nomination to serve as CMS Administrator. A native of Willingboro, New Jersey, Ms. Brooks-LaSure graduated from Princeton University, earned a master's in public policy from Georgetown, and embarked on an impressive career in federal health policy. To say Ms. Brooks-LaSure understands the U.S. healthcare system would be an understatement. Over the course of more than 2 decades, she has amassed a deep working knowledge of federal healthcare policy and the vital role that programs like Medicare, Medicaid, and the Affordable Care Act play in the lives of patients and consumers, especially those who are from low-income communities and communities of color. CMS is sure to benefit from Ms. Brooks-LaSure's extensive experience, from her early days coordinating Medicaid policy in the Office of Budget and Management, to her work with the House Ways and Means Committee passing signature legislation like the Affordable Care Act, to her service as Director of Coverage Policy at the Department of Health and Human Services, as well as Deputy Director for Policy at the Center for Consumer Information and Insurance Oversight. Most recently in the private sector, Ms. Brooks-LaSure worked at the firm of Manat, Phelps & Phillips, helping clients in the healthcare space navigate regulatory issues often involving Medicaid and Medicare. Simply put, her credentials are impeccable, and her commitment to building a more equitable and accessible healthcare system is unshakable. If confirmed, Ms. Brooks-LaSure will be the first African-American woman ever to serve as CMS Administrator, and her historic nomination comes at a historic moment for our country. The COVID-19 pandemic has exposed and aggravated the long-standing racial inequalities and inequities in our country that, even in good times, leave people of color more vulnerable to poor access, financial hardship, disease, and death. As we emerge from this crisis, I can think of no one better positioned or more committed to rooting out the disparities in our healthcare system than today's nominee, Ms. Brooks-LaSure. And I know my colleague from New Jersey, Senator Booker, asked me as well to join in our enthusiasm for her historic nomination. Thank you, Mr. Chairman.
I thank our colleague, and our colleague's been heavily involved on healthcare issues here today, so we're glad to hear his ringing support for the nominee. I am also, at this point, going to introduce letters of support and statements for the record. Without objection, I will make these a part of today's hearing record. We'll now have opening statements for Ms. Palm and Ms. LaSure, and then we have some formalities we have to deal with and thank our colleagues for being here. Ms. Palm. I got to talk to you about something later. I'll find you.
Thank you, Chairman Wyden, Ranking Member Crapo. Good to see you both this morning. I'm grateful for the opportunity to testify before you today as President Biden's nominee for Deputy Secretary of the United States Department of Health and Human Services. I want to thank Senator Tammy Baldwin for the kind introduction and for her work on behalf of the people of Wisconsin. I'd also like to acknowledge and thank my husband, Dan, who is here with me today. And thank you to the members of this committee for considering my nomination. I've enjoyed the opportunity to speak with many of you individually throughout this process. I was born and raised in Star Lake, New York, a town of about 1,000 people. When you grow up in a small town, you understand from a young age that together is the only way to get things done. That sense of community was formative and is what led me to become a social worker. I spent my 20s as a caseworker, finding safe homes for children in crisis and working with people in behavioral health crises. These experiences shaped the rest of my career. It was the children and families I worked with during this time that made me want to change the system and drew me to public service and to public policy. The memories of these kids are what still motivate me today. I've spent my entire career focused on health and human services policy and lifting our most vulnerable communities. From my time in the Senate, working on the HITECH Act, to serving at HHS, where I played a role in implementing the Affordable Care Act, and negotiating bipartisan policies with Congress like the 21st Century Cures Act. Most recently, I had the privilege of leading Wisconsin's Department of Health Services. I'm proud of the work we were able to accomplish in Wisconsin. There, we found ways to make progress on a bipartisan basis, expanding access to telehealth services, our innovative children's health insurance program to tackle childhood lead poisoning, and improving the delivery of the programs at the department more broadly to better serve the people of Wisconsin. And when the pandemic hit, we led with facts, science, and transparency to protect our communities. As every single state did, we faced challenges in Wisconsin, but we built a strong statewide response, leveraging government assets and the expertise of our private sector partners to build a stable testing and contact tracing system, reaching our rural communities and vaccinating Wisconsinites. And it's working. As Senator Baldwin noted, Wisconsin is among the top states in vaccinating our residents. When I was previously at HHS, then Secretary Burwell would joke that if there was an issue that was going to require bipartisan cooperation, that the team should give it to me. She called my portfolio the Common Ground Agenda. And if I have the honor of being confirmed and returning to HHS, that's what I'm bringing with me, a Common Ground Agenda. First, we must end the COVID pandemic. I know we can all agree that we've lost far too many Americans to this virus. President Biden put forward ambitious goals, and Congress has followed through providing the resources to get the job done. If confirmed, I look forward to implementing the American Rescue Plan, getting vaccines in arms, rebuilding the public health workforce, and securing the nation's supply chain. Second, we must expand access to high-quality, affordable health care. The American Rescue Plan took a major step in bringing down the cost of health care for working families, but we can't stop there. We must strengthen our Medicare and Medicaid lifelines, reduce the cost of prescription drugs, better integrate mental health and substance use disorder treatment into the healthcare system, and ensure our global leadership in research, development, and innovation. And finally, we must prioritize human services. HHS has an important role to play, from caring for children to advancing health and well-being of people with disabilities. We must not lose sight of those core missions. HHS faces big challenges, and it's our responsibility to be tireless stewards of an agency that touches nearly every aspect of American life. To me, that's what public service is all about, making government work for the people that it serves and leaving the country better than we found it. I'm ready for the task and eager to continue serving. Thank you again for considering my nomination.
Thank you very much, Ms. Palm. We'll have some questions here in a bit. Ms. Brooks-LaSure.
Chairman Wyden, Ranking Member Crapo, and members of the committee, thank you for considering my nomination to be the administrator of the Centers for Medicare and Medicaid Services. It is humbling to be before you. And thank you to Senator Menendez for his kind introduction. My career in public service started at the Office of Management and Budget, working on CMS's budget, Medicaid, and CHIP. But after 9/11, everything changed. It did for the victims of that terrible tragedy, their families, and for first responders. It also changed for many of you and for all of us in government service. For me, my work shifted to finding coverage for dislocated workers in the wake of the attack. I worked closely with the Treasury Department and key members of the Bush administration to ensure that those impacted by the senseless attack had the health coverage they needed at such a vulnerable time in their lives. It was inspiring to be part of a bipartisan effort to ensure that people that lost their jobs as a result of the attack and the economic aftermath were able to get their health care they needed. I took that philosophy and sense of mission with me to the Ways and Means Committee and then to HHS and CMS, where I led the development of policies that expanded coverage to more than 20 million Americans. I've approached my work in the private sector with the same philosophy, working with states and stakeholders to expand coverage options, especially for those living in rural parts of the country and for traditionally marginalized communities. Today, as we navigate this public health crisis and its aftermath, that philosophy guides me yet again. And if confirmed, that is the collaborative, common sense, results-oriented philosophy I'll take to CMS to address the complex challenges we face. First, we must get the pandemic under control. COVID-19 has put unbearable pressure on frontline healthcare workers, put vulnerable seniors and those with disabilities at great risk, and unmasked inequities that persist in our healthcare system. My own hometown, a predominantly Black community where my parents still live, experienced higher rates of COVID infections and deaths compared to many of our surrounding communities. I am committed to working with you and leaders across the government to ensure that CMS is supporting patients, their families, and providers, including communities of color who have been hardest hit by this pandemic. If confirmed, I will work to make CMS programs work together better and remain the pillars of our healthcare system. This includes addressing Medicare solvency to protect Medicare for current and future beneficiaries. There is much we can do to strengthen these programs to improve quality, lower costs, and expand access, including implementing the critical reforms in last December's appropriations bill and the American Rescue Plan. If confirmed, I am also committed to working with you to expand access to innovative therapies, procedures, and models of care. We are living in an era of incredible change as researchers find new ways to conquer disease and improve our quality of life. We must bear in mind, though, that innovation is only effective if patients can actually afford it. So I will work with you to rein in healthcare costs, including for prescription drugs. I realize we may not always agree on the best approaches to solve these challenges, but I pledge to work closely with all of you to ensure that our decisions are transparent, our team accessible, and that CMS is listening to your views. Before I close, I'd be remiss if I did not acknowledge the outpouring of support I've received from women of color across this country. I'm proud that, if I have the honor of being confirmed, I will be the first Black woman to lead CMS. I would not be here without God and my family, my husband sitting behind me, my parents, my brother and sister, and the many strong, smart Black women and men who came before me. Too often, they weren't given the opportunity to live up to their full God-given potential. But their selflessness, often silent sacrifice, paved the way for me and so many other women of color. Today, I'm proud that my daughter can see her mother nominated by the President of the United States to lead such a critical agency and know that she can be anything she wants to be. Thank you for considering my nomination, and I look forward to answering your questions.
Thank you very much, Ms. Brooks-LaSure, and let the record show that Ms. Brooks-LaSure was also an intern for the Senate Finance Committee, and so we are very proud of that. Now, we've got some obligatory questions we've got to ask, and I'm just going to ask the question, and I'm going to have a response from each of you, if that'd be all right. First, is there anything that you're aware of in your background that might present a conflict of interest with the duties of the office to which you have been nominated? Ms. Palm.
No.
Ms. Brooks-LaSure.
No.
Second, do you know of any reason, personal or otherwise, that would in any way prevent you from fully and honorably discharging the responsibilities of the office to which you've been nominated? Ms. Palm.
No.
Ms. Brooks-LaSure.
No.
Third, do you agree without reservation to respond to any reasonable summons to appear and testify before any duly constituted committee of the Congress if you are confirmed? Ms. Palm.
Yes.
Ms. Brooks-LaSure. Finally, do you commit to provide a prompt response in writing to any questions addressed to you by any senator of the committee?
Yes.
Ms. Palm.
Yes.
Ms. Brooks-LaSure.
Yes.
Thank you all. All right, let's go on now to member questions. We're going to do this in 5-minute rounds, and let me start with a question for you, Ms. Brooks-LaSure, and it really speaks to this judgment that I've had, and I've had 2 colleagues sitting on my sides who have shared it with me over the years, is that I don't believe the federal government has a monopoly on good ideas. If the states can do better, they ought to be able to do it. That's why I wrote Section 1332 of the Affordable Care Act. It allows states to get a waiver to put in place fresh and creative strategies as long as they meet, and this is critical, the essential consumer protection guardrails that are embedded in the Affordable Care Act. So now, all over the country, there are states that would like to promote a public option, for example, to increase competition and hold down healthcare costs. And there's some who are interested in aggregating Medicare and Medicaid dollars because they would like to move closer to a single-payer approach at the state level. Conversely, there are states with conservative ideas that would like to advance what they believe is the right course, and they believe that they can advance those conservative ideas while meeting consumer protection guardrails. The reason I'm asking you this question, Ms. Brooks-LaSure, is you have years of experience working closely with the states. And if confirmed, I believe, when you're confirmed, you'll have authority to be involved in promulgating those kinds of guidance rules that will give a roadmap for the states on how to proceed. How are you looking at your authority with respect to the states, and particularly ensuring that both progressive states and conservative states will say they've been treated fairly, showing that they have good ideas, but never fudging on the essential consumer protection guidelines? How do you see your job in that regard?
Thank you, Chairman Wyden, for the question and for your leadership in ensuring that states had an option of applying for waivers to think about ways to improve upon the Affordable Care Act. As you said, the federal government does not have a monopoly on good ideas. And in fact, some of the best ideas that are eventually enacted in Washington start at the state level through waivers, through demonstrations, and there are so many states who are looking for the best ways to cover their populations. There's so much variety in our great country. I see the role of the federal government in granting waivers as being a trusted partner with the states who have a great deal of responsibility across the Medicaid program and in many states, their marketplaces and certainly their insurance markets, and want states to understand what the rules are, to have consistent guidance, and to make sure they are meeting the standards that are set forth in the law. Certainly agree that and know that states want to use the 1332 guidance to expand coverage and test different options in many ways. And if confirmed, CMS will certainly have an open door to states, to new ideas, and really want to treat all the states with consistency and fairness and to make sure they're meeting the bar.
One last question on this point.
Yes.
Would you make it a priority to get the guidance out so that states with different philosophical viewpoints would know how to proceed?
Absolutely. States need certainty and are on important schedules, annual budgets, and that is absolutely.
We'll have more conversations about the guidance, and I thank you for it. Ms. Palm, let's talk about this whole question of healthcare equity. I think you heard me in my opening statement say, I think there are two healthcare systems in America, plain and simple. The most affluent, and particularly those who live in suburbs, have a technology treasure trove in front of them in terms of how they can use telehealth and all kinds of services that are beneficial. Conversely, folks of modest means are just trying to figure out how to make their way through the maze of rules, even dealing with COVID services. So my question to you is, if confirmed, and I believe you will be confirmed, how would you actually lead at the department to root out the significant racial, ethnic, and geographical health disparities? Because I think that's what this is going to be all about. We're going to need leadership that has a real agenda to root out these systematic inequities. Tell us what yours would be.
Thank you, Chairman Wyden. From my perspective, as Deputy Secretary, should I be confirmed, I think about this on two levels. One is how we are working to ensure at the programmatic and policy development level, equity and an equity lens is baked into the development and implementation of our programs. And then I lift up and think operationally about how we as a department are infusing within our processes the ways we need to do the work better, to bake equity in at the beginning, and so that we are not chasing it at the end. And so that, for me, is both programmatic and policy development, but then also operationally, we have the opportunity to really structurally change the way we do our work so that everybody is responsible for equity and making sure that the work that we do is equitable and that we are eliminating the systemic issues that have brought us to where we are today.
I think your point about individual accountability, my time is up, is hugely important because at the end of the day, these issues have just gotten short shrift. I mean, the country has known about them. People say that you ought to do something about it, but it's really time for the kind of accountability that you just mentioned. Senator Crapo.
Thank you very much, Mr. Chairman, and I want to return in my questioning to the issue that the chairman dedicated his first question to, that of waivers. I appreciated the chairman highlighting this issue and the focus that he brought to it. Waivers are an essential tool for states, allowing them to tailor insurance programs to fit the needs of their patients. Across the country, states continue to prioritize flexibility and the use of innovative local solutions to expand coverage. Unfortunately, this desire for flexibility has met federal government roadblocks, and this is especially true for Idaho. As I mentioned with both of you privately when we talked, Idaho has tried numerous creative approaches to expand and coordinate coverage between certain individual market and Medicaid populations. Medicaid 1115 waivers grant important flexibilities for states to improve benefits and to try new ideas in their Medicaid programs. Obamacare's 1332 waivers allow states to implement policies that stabilize the market, lower insurance costs, and incent competition, provided, as Senator Wyden mentioned, that the guardrails are protected. Yet when states try to merge the two waivers to coordinate and expand coverage, they're met with rejection and disappointment from the federal government far too often. This appears to be a statutory problem in many cases that prevents novel approaches to creating more seamless, harmonized insurance markets for patients. Without solving this issue, states must deal with population churn, inconsistent benefits, budget uncertainty, and the inability to advance changes that would improve care. I realize you can't change the statutes, but I do believe that as much flexibility as possible to allow states to use these creative options should be utilized. And I just first want to ask, and I think you've already basically said this to Senator Wyden, but if confirmed, would you work with me and others interested in improving the 1115 and 1132 waiver coordination through statute? It's just a yes or no for each of you.
Yes.
Yes.
And I appreciate that. And while this waiver work is underway, do you commit to incorporating state perspectives and expertise in CMS and HHS decision-making to ensure that local solutions to address coverage are included in your work?
Yes.
Yeah.
Yes.
Thank you. And finally on this, I'm deeply concerned by the current administration's approach to Medicaid waivers that were granted in the last administration. In other words, what will be the approach to waivers that have already been granted? While we should work to improve evaluations and processes for all waivers and demonstrations, the changes that have occurred this year on Medicaid waivers necessitate more immediate action. Ms. Brooks-LaSure, do you believe revoking approved Medicaid waivers or portions of approved Medicaid waivers immediately following an election sends the wrong message to the states?
Senator Crepo, thank you for raising the issue. And as I mentioned, I do a lot of work with states and understand how much they want certainty from the federal government. That's something, if confirmed, I will really work to make sure that states understand decisions and, as you said, are part of the decision making.
All right, thank you. And in the little bit of time I have left, I want to go back to you, Ms. Brooks-LaSure, on the Medicare Advantage issue. Mm-hmm. I'm a huge advocate for Medicare Advantage. I think it's one of the best working pieces of Medicare, and we should do all we can to take advantage of it. During the COVID-19 pandemic, CMS provided Medicare Advantage plans with additional flexibilities, such as expanding telehealth services, providing beneficiaries with devices to use for telehealth, and remote patient monitoring, and reducing cost sharing and premiums. And we found some things that really worked. Mm-hmm. How would you work with stakeholders in Congress to continue these certain enhanced benefits and flexibilities? What I'm talking about is, why do we have to stop this when the pandemic ends? Could you respond to that?
Absolutely. I think that as this pandemic has given us an opportunity to take the lessons across a variety of issues, and telehealth has been something that's been discussed for more than a decade, and now we've been able to see what value it brings. My brother is a psychologist, and he's been able to see more patients during a difficult time as a result of it. I really want to work with all of you to look at what CMS's administrative authority is and what changes we may need congressionally to work on bringing the lessons that we've learned from COVID into our healthcare system on a permanent basis.
All right, thank you very much. My time's expired, so Ms. Paul, I'll have to probably send you some questions for the record.
Thank you.
Colleagues, here's where we are. Senator Stabenow will go next in person, then we'll have Senator Grassley on the web, and then we'll have Senator Cantwell in person. Senator Stabenow.
Thank you very much, Mr. Chairman, and welcome to Ms. Palm and to Ms. Brooks-LaSure. We are so lucky to have both of you willing to commit to public service at this very important time, and I'm very impressed with your credentials, both of you, your experience and your credentials. I care about every part of the healthcare system, as you know. I've worked for years. It was actually healthcare that got me into my own public service, but I think it's probably no surprise that I'd like to start talking about behavioral health. And so I would ask both of you, and I know, Ms. Palm, that you were at HHS when Senator Roy Blunt and I were able to pass the Excellence in Mental Health and Addiction Services Treatment Act, and that you were involved in the initial implementation and establishing the quality standards. So I appreciate that very much, and I know you both have been involved in these issues. But as you know, so many people are living with mental health issues and addiction issues right now, even more because of COVID. In January, 41% of American adults reported that they were struggling with anxiety and depression, and that is up from 11% before the pandemic. So we have serious, serious issues. And more than 1 in 4 young people have reported suicidal thoughts. Meanwhile, communities are seeing more people overdose. Just yesterday, the CDC reported that more than 87,000 Americans died of drug overdoses over a 12-month period that ended in September. The most deaths in a year since the opioid epidemic began in the 1990s. Again, serious alarm. So long after the epidemic ebbs, these behavioral health issues will linger. And as I've talked to both of you about, I believe strongly we need to treat healthcare above the neck the same as healthcare below the neck as part of the healthcare system. The good news is that through certified community behavioral health clinics that we now have in 41 states, and expanding now because of the American Rescue Plan as well. We have a structure that allows clinics to truly meet the needs of the community. This has been a tremendous success, a model for the future, and I have to commend our chairman on the CAHOOTS program, which this model also embraces as a partnership. So this is so, so important. And now we have the opportunity to expand it nationwide, so that every state has the opportunity to meet quality standards and provide comprehensive services. And now is really the time to do that. So my question, I'll start with Ms. Palm, is could you talk about your experience working on behavioral health issues and how you'll work with us to ensure high quality comprehensive care, including through the CCBHC program?
Yes, thank you for the question, and thank you for your leadership on this issue. I think to your point, the bipartisan nature of the work that you and Senator Blunt have done on this, the bipartisan work that has happened around the opioid epidemic really does afford us a critical opportunity at this moment to do additional work to really, as I mentioned in my opening, integrate behavioral health into the healthcare system. Your analogy of the neck up and the neck down is exactly right, and I think it's really time that we think about mental health, substance abuse, the behavioral health issues as chronic conditions that need to be managed and treated the way other healthcare conditions are, and that the health and wellness of people and putting them at the center of their healthcare means that we have to do that for behavioral health. I've worked in behavioral health from direct service all the way to, as you mentioned, implementation of programs, and then most recently running them at the Department of Health Services in Wisconsin. And so I would look forward to the opportunity to work with you and others in this committee to really sort of turn the crank and take these next important steps in behavioral health.
Thank you. Ms. Brooks-LaSure.
I join my colleague in thanking you for your bipartisan work in this area and highlighting just how much of an issue this is. It has been, and then as you stated, with COVID-19, it's been an incredibly difficult time for a host of people, including children, as for a number of reasons. I think that having one of the important pieces is increasing providers, which is what the work of your clinic does by making more availability. We've seen telehealth help in this area. One of the things, if confirmed, I really want to focus on is helping CMS to coordinate better with the department on these critical issues. States are doing some incredible things in their Medicaid programs and really coordinating that with the grants from SAMHSA to make sure that we are integrating behavioral health and substance abuse with physical health. And finally, to mention, of course, mental health parity is an important part of CMS's role of enforcing and ensuring that mental health services are treated equally.
Thank you. Mr. Chairman, I know my time is up. I have just one other thing I want to mention, no question, though, and that is, and that's school-based health clinics, which are also, right now, we've authorized school-based health clinics at the end of the year in a bipartisan legislation, but they are not yet funded, and yet we know that children and young adults have been hit particularly hard by the pandemic, not only anxiety and depression and other issues, but routine vaccination rates are down, and many children have missed primary care, doctor's appointments, and dental visits. And so Senator Capito and I are working together to secure funding for these clinics that have been authorized. We invite all of our colleagues to join us. I will also be want to work with each of you on these issues to make sure that school-based health centers are able to get the CHIP funding and Medicaid funding that will allow them to, again, be a permanent part of our healthcare structure. This is very, very important for our children. Thank you, Mr. Chairman.
Thank you, Senator Stabenow. Senator Cantwell.
Thought Senator Grassley was next.
Oh, excuse me, he's not available right now.
Okay, thank you, Mr. Chairman. Just wanted to make sure we weren't skipping
Thank you.
ahead. Thank you to the witnesses and congratulations on your nominations. Certainly support moving you forward. We've had a chance, at least our CMS nominee, Ms. Brooks-LaSure, to talk about the basic health plan. I mentioned to you how in New York, approximately 800,000 people are enrolled in a plan that costs $500 annually for a family of four buying coverage. That saves $1,000 compared to the Silver Exchange plans, and it saved the state billions of dollars as well. So I want to make sure that it also saves us federally if more states implement this. So I want to hear if both nominees are comfortable with states expanding this program and if you would encourage them to do so. I don't mean like tell them to do so. I mean if they wanted to do so, you'd be encouraging of that.
Yes.
Can I get it for the record so we can hear you?
Yes, Senator.
Okay.
Absolutely.
Thank you. Also, I want to make sure that the department, Ms. Palm, would assist people in the implementation of that.
Absolutely.
Okay, great. On Medicaid rebalancing, Senator Portman and I have been very big supporters. I just want to add that Senator Stabenow was also a big supporter of the basic health plan, and so don't want to, she very much appreciated her efforts in getting that implemented, and we'd like to continue to see the implementation. On the money follows the person, Senator Portman and I and several others have been continuing to push that, giving over 8,000 individuals in long-term care facilities the ability to go back into their homes and saving Medicaid dollars. We feel like this has been that and rebalancing in general, a big cost savings. So Ms. Palm, will you work with states to implement money follows the person program to ensure seniors and people with disabilities can avoid institutional living?
Absolutely.
Thank you. And Ms. Brooks-LaSure, do you support federal incentives like those to help states move people from these high-cost institutional settings?
Yes.
Okay, great. My colleague just covered mental health. So on my colleague from Idaho's conversation about telehealth, let's see if we can get a little more granular here. What do you think, how do you characterize where the reimbursement rate should be? I've had great conversations with the University of Washington, Paul Ramsey, the CEO of that institution's healthcare system. So in the Northwest, we definitely are going to support more broadband access. We definitely see how this worked. You mentioned your brother. I can tell you personally, there's lots of indications in my state of how successful this has been. I think we got a real feel for the medicine of the future. So what do we do about the reimbursement rate? Is it 100%? Is it the same? Is it slightly different for some reason? Where do you think we are? And I'll start with you, Ms. Brooks-LaSure.
Thank you for the question. I think it's an incredibly important issue, and one, as you said, has been really critical in a number of states in rural areas. And we need to think about how we continue to move this issue forward. Reimbursement, I would say, is something I, if confirmed, would be happy to talk to you and think through. There are certainly safeguards that we need to make sure to from a program integrity perspective, to make sure that we know what that services are being delivered. But it's one that I think that we can, we'll have to titrate but figure out.
Okay. For somebody who is intellectually smart on this subject, I consider that a little bit of a punt. But I think the issue, I'm good with examining the savings. But I would say to people that this is just a new efficiency discovered in the information age, with COVID being the thing that prompted us here. But my guess is we're going to see huge savings. So I would say you're at or close to the reimbursement rate that we're at today. Like, it's almost something we want to incent, just like we've had pay follow the person, just like we've had these other things. Why? Because we're going to discover that there's probably savings here in the system overall. So anyway, I don't know if you have any comments, Ms. Palm.
I would echo what my colleague said. I would also say we worked hard on a bipartisan bill in Wisconsin to bring telehealth into the Medicaid program, where we treated them the same for purposes of coverage and reimbursement. And we're really so grateful to have had to put that statutory framework in place before the pandemic, and used our flexibilities to really make sure we were ensuring access during the pandemic. But I would certainly welcome the opportunity to continue working with you on this issue.
Thank you. Well, Mr. Chairman and Senator Crapo, I think this is an incredibly important subject. We, in the Commerce Committee with Senator Lujan, will be working on a broadband piece for the delivery system. And one thing we really like is that, that we do have, even in rural communities, rural hospitals everywhere. So they are a system of delivery. And I think, though, it would be foolish not to try to pair the broadband investment with the right reimbursement rate, because otherwise we would be making this investment in giving us access, but not having the utilization, because physicians, or the system would continue to defer to see people in person. So we got to get it right, and so appreciate my colleagues. Thank you.
Senator Cantwell, as always, you are out in front on these issues, and Senator Crapo and I have been talking about a bipartisan effort in this telehealth area. And as part of the critical reimbursement issue you mentioned, because this committee really shoehorned the telehealth efforts into the first CARES package, I think it's going to be important to make sure that right now, as a result of the pandemic, we've removed some of the roadblocks for people to actually get to a telehealth provider. We're going to have to make those kinds of changes permanent, in addition to working on the critical reimbursement issue you mentioned. And I want to thank Senator Crapo, because he's indicated that telehealth could be one of the real bipartisan priorities for the committee.
Well, I'm pretty sure the three of us, whether it's the Panhandle of Idaho or Eastern Oregon or the Okanagan in my state, we see a very dispersed rural healthcare delivery system where people have to drive hours. And so I think this would be very helpful. Thank you, Mr. Chairman.
Thank you for your leadership. We're now on to Senator Cassidy on the web, and then Senator Bennett. Colleagues have a hectic morning, so we're trying in a bipartisan way to make sure that everybody gets a chance to be heard as soon as possible. Senator Cassidy, I think you're out in cyberspace, so we'd like to hear from you.
Yes, sir, Mr. Chairman. Ms. Brooks-LaSure, thanks for reaching out. I enjoyed our conversation. as I told you, I was going to follow up on dual eligibles, not as a got you question, but rather just kind of to explore it. We both know that we spend a lot of money in this country on duals, and we get miserable outcomes. Now, duals are a heterogeneous population, both in terms of who they are medically, but also in terms of the method by which they are financed. But one thing you pointed out in our conversation is the difficulty in aligning the incentive for the state and the federal government. The ACA attempted to address the duals, and yet I don't think it worked. Can you give a little bit of a kind of lessons learned from the ACA's attempt to address the lack of alignment among duals?
Senator Cassidy, I very much appreciated our conversation and enjoyed the opportunity to talk. As we talked about, dual eligibles are sometimes the most vulnerable in our society in terms of comorbidities, often very expensive for both the Medicare and the Medicaid program. I think that as we talked about, greater alignment is something that we are going to need to continue to work with. Some of that can be done by CMS administratively with getting the programs.
But let me ask you particularly, what were the lessons learned from the ACA's effort? Because I think Minnesota may have been the only state in which their particular program worked. And so again, I'd like to build upon what we've learned. What have we learned?
I would say I would want to look at the valuation, particularly around Minnesota. But what I would say is there still is a need to coordinate better on what we see in long-term care and the nursing homes and hospitalization. And some of that is going to take a legislation and really thinking about how do we treat people on the continuum. So particularly in assisted living, PACE programs, things, I think there's more we can do to encourage that kind of coordination.
Ms. Palm, you've been kind of on front and center of this in your jobs in Wisconsin. What thoughts do you have about the duals?
Mm-hmm. I appreciate the question and your point about the different financing and states and the feds working together for us. We were very focused on the continuum of long-term care services and providing the opportunity for patients, for seniors, people with disabilities, to choose care that best met their needs with the greatest amount of independence. And our ability to do that most effectively and efficiently would benefit from, as Ms. Brooks-LaSure mentioned, greater alignment as you are sort of driving towards.
Let me stop you for a second. Let me just kind of stop you for a second. I think one of the things that happened in California is that there was an incredible amount of churn. People got assigned to a program, I think run by Medicaid, but with a Medicare, I may have this wrong, you guys may know I'm correct, but the so-called patient choice ended up being churn where people were changing from program to program several times within a year, which of course destroys continuity of care, and it begs the question as to whether or not the decision as to where to receive care was informed or whether it was perhaps influenced by those who had other agendas. Any thoughts upon this? Is there a way to address that? I'll start with you, Ms. Palm.
Yeah, I would say, Senator, we saw much more churn in our non-long-term care population in Wisconsin. I'm not saying that that's what you're raising isn't an issue.
No, I'm saying among duals in general,
Yeah, I think that sort of to your fundamental point, continuity of care coordination, making sure that we're putting patients at the center of the care they're receiving, and doing what we can to do that efficiently.
I guess I'm not making my point, Ms. Palm. Everything you're saying is true. What I'm trying to get at is how do we address the churn?
Well, I think, Senator, from our perspective in Wisconsin, we wanted to make sure that the products that were available and the choices that seniors had were that it was transparent on the front end, that they understood them, and that when they made their choice, they made a good choice for them, so that there wasn't a need to change on a continuous basis.
So what was your rate of churn in Wisconsin? I'm just curious. I don't know that answer.
Again, I'm not sure I can remember off the top of my head in long-term care versus in the regular population, but I would be happy to get that information back to you, Senator.
Okay, I yield back. Thank you.
I thank my colleague. Senator Menendez is next.
Thank you, Mr. Chairman. In March of last year, as COVID began to spread in states like mine, the shutdowns helped save lives. But at the same time, there were systems in place to help individuals who rely on home and community-based services to continue to access care in such a situation. The scarcity of protective equipment meant many providers weren't able to access necessary gear. Fortunately, the American Rescue Plan provided an enhanced FMAP for these services. My question to you is, will you commit to working with states to swiftly roll out information on how states can spend their increased FMAP for home and community-based services?
Yes, sir.
Okay. COVID-19 has disproportionately impacted Black and Latino communities. I'm pleased to see this administration is committed to improving health equity. However, even as we've seen record-breaking developments of diagnostic treatments and vaccines for COVID-19, members of the most heavily impacted communities do not have equal access to clinical trials for these innovations. And I believe we have to take active steps to remove these barriers. So, Ms. Brooks-LaSure, what role do you see for CMS to play in improving minority clinical trial participation?
Thank you, Senator, for the question. This is such a crucial issue, and I'm glad that Congress has made it so that Medicaid will be paying for covered services to make sure that people can get into clinical trials. I think CMS can do more to integrate with NIH, as well as work with trusted partners. One of the things that I think we've learned with the pandemic is how important it is to have the medical community, community organizations, really making sure that communities of color feel trust in these types of programs.
So will you commit to working with me on improving clinical trial diversity?
Absolutely.
Ms. Palm, the same question to you.
Yes, sir.
Thank you. Now, throughout the pandemic, Americans have deferred health care. An October 2020 study in JAMA found that primary care visits declined 21% during the second quarter of 2020 as compared to the same time frames in 2018 and 19. In particular, I'm deeply concerned that delays in cancer and other screenings will translate into an increase in advanced disease cases and ultimately death as a result of millions of Americans avoiding routine preventative care over the past year. And once again, I fear these delays in care will disproportionately harm health care outcomes for Black and Latino communities who already have less likely access to preventative care. So, Ms. Brooks-LaSure, what steps can the Centers for Medicare and Medicaid take to raise awareness and encourage Americans to seek important and necessary preventative screenings that have been delayed as a result of the pandemic?
You are so right to raise this issue with so many people being concerned about going back to their providers. CMS's role, because of the Affordable Care Act, preventive services across several of the programs are free because of its importance. CMS needs to continue to educate providers, beneficiaries, patients, and families, and again, working with stakeholders who are trusted partners to encourage people to get preventative care.
Ms. Palm, what additional steps can HHS take to help raise awareness of this looming issue?
Yeah, it's a great question and really does lend itself to an opportunity across the department through our HRSA programs, through SAMHSA, through other IHS, through the other avenues that we have to reach the people that we serve with these messages, encouraging folks to return for care, for the preventative treatment. And so we should use all of our channels as well as our partners to reach people and encourage folks to return for care that they need.
Finally, I worked on a bipartisan basis with members from both urban and rural areas at the end of the last Congress to secure 1,000 new Medicare-supported graduate medical education slots in the Consolidated Appropriations Act, the first increase in this position in nearly 25 years. Senator Boozman and Leader Schumer joined me in reintroducing the Resident Physician Shortage Reduction Act, which would build upon our bipartisan success by further increasing federal support for GME. Now that Congress has provided the slots, it will be up to the administration to determine their implementation. And it's important that they are distributed in a timely and efficient manner. How would you plan to ensure smooth implementation of these critical new GME slots, and how do you envision working with Congress to address physician shortages?
Thank you, Senator, for your work in this critical issue, and very much understand that the congressional intent is for these slots to go particularly in underserved areas. I, as we've talked about, want to make sure that we have an open dialogue, one with public notice and comment, where stakeholders can engage, and certainly an open door to hear your views.
Well, we look forward to working with you on that. Thank you, Mr. Chairman.
Thank you, Senator Menendez. Senator Bennett has to preside on the floor, so
Thank you,
proceed.
Mr. Chairman, and I thank my colleagues for letting me jump in. Ms. Palm and Brooks-LaSure, thank you for your willingness to serve and for all the work you've done to pass and implement reforms such as the Affordable Care Act, which dramatically improved coverage and affordability for health care in this country. Despite the ACA's strides in coverage and affordability, many Coloradans and many Americans still face high costs and limited options. The American Rescue Plan expanded eligibility to the ACA premium tax credits. This capped how much Americans are paying for health plans on the exchange, which was, I think, very important, but still not enough. Separately, Senator Kaine and I have previously introduced the Medicare X Choice Act. It would work within the Medicare framework to establish a public option for individuals, families, and small businesses. It would also make the American Rescue Plan caps permanent. As you know, President Biden ran on a public option as the answer to creating universal health care in this country. So I would ask that if you're confirmed that are both of you committed to working with me and others on the public option, and when it passes, implementing it to ensure that every single American has the health care choice that they need.
Senator, thank you for your leadership on this issue and for passing the American Rescue Plan, which, as you've said, has significantly helped with affordability for middle-class families and given states options to expand the Medicaid program. Of course, we will work with you and really want to advance the President's agenda, and as you said, he is supportive of a public option.
Ms. Palm?
I would concur with my colleague. Look forward to working with you.
I think this is something we should get done now. You mentioned it, Mr. Chairman, in your questions. The American people coming through this pandemic understand how critical it is for us to have everybody have access to primary care. And this was litigated extensively during the campaign, both the Democratic primary and the general election. And so I hope the Biden administration will take us up on our offer to be helpful in fulfilling these commitments, and I look forward to working with the chairman as well. Children with complex medical needs may not be able to receive highly specialized care that they need in their home state. This requires families and state Medicaid officials to go through the difficult process of finding out-of-state providers. Senator Grassley and I worked hard to pass the ACE Kids Act, which will be implemented in October of 2022 and would enable better care coordination for these kids to make sure that they get the best services no matter where they live. As a follow-up, last year we introduced the Accelerating Kids Access to Care Act. This bill would provide certainty for state Medicaid agencies to better determine who is responsible for paying and reduce regulatory burdens that can slow or prohibit access to care. If confirmed, will you commit to a timely implementation of the ACE Kids Act and work with us on the Accelerating Kids Access to Care Act so we can make sure we're taking care of the nation's most sick kids? Ms. LaSure?
Yes.
Thank you.
Yes, I would welcome the opportunity, Senator.
Thank you. I would welcome the opportunity, too. I guess I have time for one more question, so I'm going to ask. In December, we passed the No Surprises Act, which will end the practice of surprise billing. I think this was a major step to protect patients who are often taken advantage of in their most vulnerable state. I've been working on that effort for years with Senators Cassidy and Hassan and others on the committee, and I'm grateful it was signed into law. Ms. Brooks-LaSure, in your written statement, you mentioned you have the responsibility to implement the legislation before it goes into effect next year. Can you highlight your thoughts on implementing surprise billing and reiterate your commitment to implement the legislation over the next year should you be confirmed?
Thank you, Senator, and thank you to this committee who has done so much work. Surprise billing has been an incredibly difficult issue for patients. Several states before you passed legislation had legislation on the books, but thank goodness that you all were able to reach a bipartisan agreement and really make sure these protections are in place. If confirmed, I will absolutely work very hard to implement the regulations. I know we're on a very tight timeline, so I hope that I am so fortunate as to be confirmed quickly to help with that effort.
Great. Thank you very much for your testimony. Thank you, Mr. Chairman.
Thank my colleagues. Senator Carper is next.
Good morning. Great to see you both. Enjoyed talking with you by phone the other day. Thank you for joining us today, and congratulations on your nominations. We look forward to swift confirmation and the opportunity to work with you for any number of years. I have the opportunity we have a bunch of caucuses here in the United States Senate, as you may know. One of those is called the Senate Community Health Center Caucus, and the last time I checked, we have about 1,400 federally qualified community health centers across the country. I think one of the smart things this administration has done early in its tenure was to make sure that people in neighborhoods across America can go to the federally qualified community health center and be vaccinated. I think that's a great move, and I think as we especially reach out to communities of color, folks that are frankly skeptical about taking the vaccine at all, it's a very, very wise move. Ms. Palm, can you think of any other areas where community health centers could be better leveraged to address rural and health, ethnic health disparities in our pandemic recovery?
Thank you for the question, Senator, and for your leadership on this issue. I think from my experience in Wisconsin, I can tell you our partnership with our community health centers was critical, both before the pandemic and during the pandemic. Areas like behavioral health and their ability to be providers in that space, particularly in rural communities, was a critical asset they brought to the table. We have a shortage of dentists in the state of Wisconsin, so dental care in our community health centers is a critical access issue, again, particularly in rural communities. But to your point, their ability to reach underserved and ethnic minority communities is really critical for us to tackle some of these health disparity issues and deal with those head on. So I think there's lots of opportunities for us to continue to work with those critical partners, and I look forward to doing that.
All right, good. Ms. LaSure, do people call you Ms. LaSure, or do they call you Ms. Brooks-LaSure? What do people...
They call me Chiquita.
I want so badly to ask you who you're named after, but I'm not going to go there. So. Ms. LaSure, as you know, we're not out of the woods yet on the pandemic. I think we're making some good progress. A lot still to be done, but it's incredibly important that we keep the main thing. That's to get as many people vaccinated as quickly as we can. When I was governor, I was very active in the National Governors Association and helped stand up something called the American Legacy Foundation, which was very actively involved in messaging on youth smoking, trying to convince young people who are not using tobacco not use it, those who were using it to stop. Hugely successful initiative. And we're in a situation right now where we need a hugely successful messaging process on convincing people to accept vaccinations. And part of that is coming out of the private sector. Part of it's coming out of like NYU. Part of it's coming out of a coalition led by former governors, I think, of Idaho and Massachusetts. And but I think there's a shared responsibility. And just talk to us, if you will, about that shared responsibility, the role that the Department of Health and Human Services plays in getting that message out and convincing people to take the vaccine. Thank you.
It's so important. Thank you for your leadership in this area of making sure that people know that and are aware that they can get vaccines, that they don't have to pay for them. I want to again talk about how what I really would like to see for CMS is to continue to partner with organizations. One of the things that I've heard over the last couple of months is how much people want to know, have their providers taken the vaccine? My brother-in-law, who sees many patients, he's a nephrologist, got vaccinated in part to make sure his patients knew he was taking the vaccine. And I think it's critical that we, if confirmed at CMS, are making sure that all the programs are encouraging this, that the plans are encouraging patients to know that this is an option.
All right. One last quick question, and you can answer this for the record, but I answered a little bit while we were here, and that is dealing with drug prices, trying to rein in drug prices with the help of the SFC in Congress, and this would be for you, Ms. LaSure. In your testimony, I think you mentioned that although researchers are finding new ways to conquer disease and improve our quality of life, and this is a quote, I believe, from you, we must bear in mind, though, that innovation is only effective if patients can actually afford it, close quote. That being said, in the interest of reining in healthcare costs, in collaboration with committee in Congress, as CMS administrator, how do you plan to use your rule-making authority to address prescription drug costs? Please.
Thank you. This committee has done so much bipartisan work on prescription drugs. We have to address this issue and make sure that we are lowering costs for these innovative medicines. And as Ranking Member Crapo said, I mean, we have seen so much innovation, and we want to make sure that people have it available. I want to work with you all to make sure that we lower prescription drugs, and I'm open to really working closely with you all on that.
Oh, you'll have an opportunity in answering questions for the record to respond more fully, but I really was looking for how do you plan to use your rule-making authority to address prescription drug costs? I realize we're in this together, and we look forward to working with you toward that end. Thank you.
Thank you, Senator Carper. Senator Grassley.
Yeah, thank you, Mr. Chairman. I want to take up where Senator from Delaware just left off, because Senator Wyden and I have been working together for well over a year to lower prescription drug prices. Our bipartisan bill would cap out-of-pocket costs at seniors at $3,100. It slows the rate of growth of drug costs, saving the taxpayers $95 billion. Some believe we should let the government do more than what our bill would do. I'm not sure that CBO is very interested in giving us much cost savings on that, if any. And some people would say, in CBO would say, by doing, if you did more, you'd have to limit consumer choice and access to life-saving drugs. I believe that Congress must pass a bipartisan prescription drug bill if it's going to get done. I suppose if Democrats stuck together and you could do it under reconciliation, then that argument wouldn't hold, but I hope that isn't the course you go, and I think that a Wyden Grassley bill could get 60 votes very easy. The bill was meaningful, lower drug prices. So is there any interest in the administration beyond what you told Senator Carper to working on enacting bipartisan prescription drug legislation?
Senator Grassley, I so enjoyed our conversation and so appreciate your leadership with Chairman Wyden on this area and this issue, as I know you all care very deeply about making sure that we lower costs for patients and families. I've heard from almost, I think, in all of my discussions, how much you all care about prescription drugs, and the administration certainly wants to work with Congress to come up with solutions for patients.
And would I assume that that would be in a bipartisan effort?
Absolutely. If people are interested, which I know you are, in lowering costs, the importance is making sure we get this right.
On rural health care, this is a big item for me and even for the chairman, because Oregon is a lot rural as well. I led a charge to create a newly voluntary Medicare payment program called Rural Emergency Hospitals. It's a new voluntary Medicare designation, I suppose, something specifically for critical access hospitals. It would let hospitals maintain essential medical services in their communities, like 24/7 emergency care, outpatient care, ambulance services, and obviously a lot more. It will also let certain rural hospitals right-size their healthcare infrastructure, letting them provide services that better align with the needs of their community. Maybe this is something both of you should comment on, unless you don't have to repeat the first person. But for both of you, can I have your commitment to implement the Rural Emergency Hospital program as quickly as possible, and I suppose as fairly as possible?
Yes,
Yeah.
Senator.
Okay.
You have my commitment, Senator.
Okay, thank you, and I appreciate that discussion we had in my office. During the last, this will probably have to be my last question. During the last 2 years as chairman of this committee, I worked to ensure that HHS, Office of National Security, receive access to intelligence community information. This included information involving threats to the nation's health because of the virus. That office has gained access to some intelligence community elements, but more must be done. On March the 8th, I wrote a follow-up letter to HHS and the Director of National Intelligence asking what they've done to incorporate federal health agencies into the intelligence community. HHS has failed to respond, so I hope you can help us get a full response to that letter. So let me go on to the second question. Do you agree that China is a significant and consistent bad actor when it comes to stealing U.S. taxpayer-funded intellectual property and academic research? If so, what will you do to protect American work product from the communist Chinese government's theft and espionage activities? And if you don't feel that way, why?
Senator, I'll take that one first. If I'm lucky to be confirmed as Deputy Secretary, I think that this is a place where my office and where I will certainly play a role in making sure, to your point, that HHS is read into intelligence that is that pertains to our healthcare system, our data privacy, some of the cyber issues that we hold at the department. To your point on intellectual property, and I think it's a critical issue as we think about how we maintain and reassert our leadership in technology and innovation, and bringing our products to market in a way that continues to drive the healthcare system forward. And I would look forward to the opportunity to work with you on both of those issues, should I be confirmed.
Thank my colleague. Senator Cardin.
Mr. Chairman, can I be recognized for 30 seconds out of order, please? To our witnesses, I'll say, I have the privilege of working along with Sheldon Whitehouse and Ben Cardin and others on this committee, on the Environment and Public Works Committee. We spent a lot of time in the last Congress trying to come to agreement on water infrastructure, clean drinking water, that sort of thing, wastewater, sanitation stuff. We came close to getting it done. Couldn't. We came back and we're using that as a building block to work on it. We're going to be on the floor next week with our water infrastructure legislation, all bipartisan. And the other thing is, we spent a lot of time in the last Congress trying to pass service transportation reauthorization, 5-year bill, and which we have part of the jurisdiction for. Couldn't get it done. We're coming back and using what we did last year as a building block. I just think you, Mr. Chairman, you and Senator Grassley, before he leaves, you fellows did great work. Your staff did great work. And we ought to be using your work as a building block in this Congress on drug pricing. And I would just urge us to do that. Thank you.
I thank my colleague for his kind words, and I know we're going to talk about that topic this afternoon. Our next is Senator Cardin, who's on the web.
Thank you, Mr. Chairman. Let me thank both of our nominees for their willingness to serve our country. Ms. Palmer, I'd like to start with a question following up on Chairman Wyden's point in regards to minority health and health disparities. I heard your answer, but I would like to at least call attention to the fact that we have offices within the Department of Health and Human Services that are devoted to minority health and health disparities. We have the National Institute of Minority Health and Health Disparities. And we've been talking about a commitment to really deal with the systemic challenges that we have in healthcare in America. It came out very clearly in COVID-19. So I would ask that you are committed to using every resource we have, including the direct involvement by your office in the minority health offices to develop a strategy to make fundamental changes in our healthcare system to help the underserved communities. Your response.
Yes, sir, I appreciate you raising this and for your leadership in the creation of those components at HHS. And we need to integrate them in our work because I think the challenge is that we can't allow those offices to be seen as the only places where that work happens. And so it's critical that they exist, but it is critical that we integrate them in a way that helps us all be accountable for the equity work that we need to do.
I thank you for that. I agree completely with that. These offices are critically important, but they need to be integrated into the overall strategy on our healthcare policies. I also was listening to my colleagues talk about telehealth, and I certainly concur in their view that telehealth offers tremendous potential for access to care, particularly in underserved communities. We talked about it being available in those who understand how to use telehealth and have the access to it, but we also need to make a priority dealing with the underserved community with access to telehealth, as well as structural changes within the reimbursement structure to allow the development of telehealth in so many different fields. We did that during COVID-19. We made some of those provisions permanent. We need to expand that, and I look forward to working with you and the other members of the committee as we expand telehealth. Ms. Brooks-LaSure, I want to ask you, we had a chance to talk about the fact that the department has started the process of filling the chief dental officer. I just really want to underscore the importance of getting that position filled as soon as possible. It was vacant during the Trump administration, but it demonstrates a priority within CMS to deal with the issues of oral health. So I hope that you'll pay attention to getting that position filled when you are confirmed.
Absolutely, Senator Cardin. You have my commitment to that, and I want to thank you for your leadership in keeping the memory of the young boy who died because of lack of dental coverage. It will be a priority of mine to make sure that the Medicaid and CHIP programs have a dental officer who is informing the work.
Thank you. DeMonte Driver was that individual who died in my state in 2007. And it did change our understanding of the importance of oral health care as policymakers. And I'm pleased that we took action both in the CHIP program and in the Affordable Care Program. My last point deals with the issues of prescription drugs. And one area which is totally unacceptable. In the wealthiest nation in the world, we have relatively inexpensive drugs that are in drug shortage because drug manufacturers don't make the same amount of profit on those drugs as they do on others. In some cases, they're single source manufactured drugs. And I would ask that there be a commitment by both of our nominees to make sure that circumstance does not exist in this country, that we don't have drug shortages of inexpensive drugs that are not being made available solely because of the lack of profit motive to the private sector. And if I could have a commitment to work with us to deal with those drug shortages. Let me start first, if I might, with Mrs. Palm.
Yeah, you have, it's a critical issue, Senator. You have my commitment.
Thank
and
you.
mine
Ms.
as well.
Brooks, thank you. Thank you, Mr. Chairman.
Thank you, Senator Cardin. The next, and I believe he's on the web, would be Senator Thune. Is Senator Thune out there in cyberspace? All right. Then Senator Brown is next, also on the web.
Thank you, Mr. Chairman. I just want to thank Senator Cardin for always raising oral health and dental health, and that is so, so important. So for both for Medicare, obviously, and Medicaid, but especially Medicaid in the work that he's done. Thank you for that. Thanks for both of the witnesses today, your willingness to serve, for your commitment to reducing health disparities, prioritizing policies to address social determinants of health. The history of institutional racism within our healthcare system continues to affect health outcomes for communities of color. I chair the Banking Housing Committee. We just did a hearing yesterday on from the black codes to Jim Crow to redlining to the Trump administration locking in discriminatory housing practices, what that's meant to healthcare and to wealth accumulation and inequality and all that. So what you're doing in healthcare is so very important. Ms. Brooks-LaSure, question first for you. Medicaid, Medicare, not just payers, they're powerful tools to advance healthcare quality and access, to improve population health outcomes, and act as economic drivers for workers in their communities. Will you commit to working with my staff and others on this committee to create and strengthen initiatives across CMS to address social determinants of health and reduce health disparities?
Absolutely, Senator, and thank you for your leadership in this role, this critical issue, and it's certainly a priority of mine.
Thank you. We knew that. We wanted to hear you say it again, so thank you. One of the topics I raised with Secretary Becerra at his confirmation hearing was the growing gulf between traditional Medicare and Medicare Advantage. In recent years, both Congress and HHS have expanded the scope of benefits available to those enrolled in Medicare Advantage plans without doing so for those individuals who chose to remain in traditional Medicare. I mean, you've seen what's happened over 20 years of essentially privatization efforts. This question for you both, if confirmed, will you work with me to ensure all Medicare beneficiaries, whether they're in traditional Medicare or enrolled in Medicare Advantage plans, have access to the same benefits and out-of-pocket protections?
Yes, Senator.
Yes, sir.
Okay, thank you. One final issue for Ms. Palm, the Children's Hospital's graduate medical education programs of critical importance to Ohio's 6 freestanding children's hospitals. Senator Casey and I have for years worked together on a number of children's issues where he's led, and especially with children's hospitals, our states have some of the best children's hospitals in the country. Ms. Palm, will you commit to working with Senator Casey and me in future and the future head of HRSA to make sure that the Children's Hospital CHGME graduate medical education program and training for our next generation of pediatricians remains a priority for this administration?
I would be happy to, Senator.
Thank you. It's never been easy with any administration, and by budget time and other things for GMEs, for Children's Hospital GME. So we're counting on you to be a little bit different and a lot better from some of your predecessors, Ms. Palm. Thank you so much. Mr. Chairman, I yield back 1 minute and 40 seconds.
Thank you, Senator Brown. Always leading, always leading. Senator Thune, are you available now? All right, then we have Senator Casey and Senator Whitehouse next. Senator Casey,
Mr. Chairman.
Good.
Yes, Mr. Chairman, thank you very much. And thanks for your leadership on a number of the issues I'm going to raise with our 2 nominees. Ms. Brooks-LaSure and Ms. Palm, we're grateful for your willingness to continue public service, especially at this time. I wanted to start by talking about an issue that, frankly, we have not spent enough time on over the last decade in terms of what the federal government does, and that's home and community-based services. President Biden's American Jobs Plan calls for a bold investment in a great American idea, which is Medicaid home and community-based services. The president has acknowledged what every family in America already knows to be true. Caregiving is part of our basic American infrastructure. It's part of who we are. It's how we function. It's part of our efforts to build back better, with the emphasis on the word better. Not the old way, not the way it was in 2019, better, and I would hope much better. Just as our society needs bridges, waterways, and roads to function, families need services and supports to care for older family members, to care for people with disabilities, and to care for children. The President's proposal builds on the $12.7 billion in funding for home and community-based services that was made possible when Congress passed the American Rescue Plan. We know that investing in home and community-based services will, number one, improve the lives of both seniors and people with disabilities. It will, at the same time, increase wages and benefits for workers. And thirdly, it will create jobs, a lot of jobs across the country. A majority of these workers are low-income women of color who earn an average of just $12 an hour. An investment in their work is not only long overdue, it's consistent with American values. If we claim to be the greatest country in the world, but our home and community-based services are not anywhere near the best in the world, we can't say we're the country we claim to be. And for seniors and people with disabilities, access to these services is the difference between simply just surviving and indeed thriving. So I'd ask both Ms. Brooks-LaSure and Ms. Palm one fundamental question, and I'm going to ask you both the same question. I'd ask for your commitment to work with us to secure funding for these services, the funding the President has outlined, and thereby realize the President's vision for home and community-based services. Ms. Brooks-LaSure, I'll start with you.
Yes, thank you, Senator, for your work on this issue and so many of the members of this committee. Yes, I pledge to work with you on this.
Thank you.
You have my commitment as well, Senator. This was a priority in Wisconsin as we looked at the whole continuum of the long-term care system and making sure that we were modernizing and preparing for the needs of the future in this system, and it would be my pleasure to work with you moving forward.
Thanks very much. I'll stay with Ms. Palm for this question. I'm holding a document which I think I've held up when we had a virtual engagement. It's called 5 Freedoms for America's Children. This is a document that our staff worked on for a good long time. We're about to reissue it in even in more ambitious form. But when I proposed the 5 Freedoms for America's Children, borrowing directly from Franklin Roosevelt's 4 freedoms, we're focused on, of course, this in a domestic context for children. What we wanted to do was put in place a strategy for America's children. The good news is, in this long 33-page, 136-footnote document that I'm very proud of, some of the proposals in there were achieved in the American Rescue Plan. The great expansion of the child tax credit, for example, the expansion of the child and dependent care tax credit. So I just ask Ms. Palm if you would make a commitment to working with me and obviously as one of the leaders of the department, working with me to get as much of these 5 freedoms implemented in the time that you serve.
I appreciate the question and certainly your leadership on this issue. I think, to your point, if I'm confirmed, the Deputy Secretary has the opportunity to leverage across the department. We touch children in a whole variety of ways in various programs at ACF, at SAMHSA, at HRSA, and across the board. And I would welcome the opportunity to work with you moving forward on these critical issues.
Well, thanks very much. And Mr. Chairman, thank you for working with me on all these issues. We're grateful. And I'll submit one question for the record on nursing homes. Thanks
very good.
much.
Thank you for your outstanding work. The order now is Senator Thune next, followed by Senator Whitehouse and Senator Hassan. So, Senator Thune.
Thank you, Mr. Chairman. Ms. Palm, I raised this issue with Secretary Becerra when he was in front of the committee. But the topic of 340B is enormously important to hospitals all across South Dakota and across the region. We have 3 systems that serve the state, but also overlap into Minnesota and Iowa and Wyoming and Nebraska and other places like that. And that program has been dysfunctional, I would say, for some time now. And we've heard concerns recently from covered entities in my state about actions taken by manufacturers, not reimbursing contract pharmacies, all of a sudden deciding to dispense with that, which they have questionable authority to do, and now PBMs who are imposing conditions on hospitals in order to get reimbursed, to get payment. And that affects their ability to continue to provide a robust community benefit. So it's an issue that's been hanging around for a long time. It's a program, obviously, that Congress has expressed support for in law. And it seems like a lot of the entities that are designed to make it work are trying intentionally to undermine the program. And so I'm curious, if confirmed, how the department would respond to ensure that covered entities are not harmed by these actions taken in that sort of supply chain, if you will, both manufacturers and PBMs.
Thank you, Senator, for this question. And you're right. I recall from my previous time at HHS that the 340B program was often a topic of conversation and a challenge. So you're right. There are things we can and need to be doing in this space. I think to your point, it's a critical program for our safety net providers and for the low-income folks who are able to access drugs through the program. And I, if confirmed, would look forward to the opportunity to make sure that the program is working as it's supposed to be working, and that the oversight and implementation are appropriate, so that we really are implementing legislative intent and getting to our safety net providers and low-income communities the access that they need.
Thank you, and I'm going to hold you to that and follow up with you, but thank you for that answer. You're absolutely right. It needs to be fixed, and I hope that once confirmed that you will help us get on top of this issue as quickly as possible. Let me just ask you, too, if confirmed, the Indian Health Service is one of the many operating divisions that would fall under your purview. As you may know, for several years, IHS facilities in the Great Plains region have struggled with staffing and quality of care issues. Could you discuss your approach for how you would manage IHS, drive quality improvements, and ensure accountability to Congress? And maybe as a follow-up to that, would you support legislation that would enable IHS to terminate poor-performing employees and also to streamline the hiring process to enable the recruitment of talented healthcare professionals?
Mm-hmm. I really appreciate the question, Senator. I think that IHS is such a unique part of the Department of Health and Human Services, and when I served previously, I had the opportunity to visit an IHS facility in your state, and so I certainly understand firsthand the need for the work that is before us to make sure that our tribal communities are receiving high-quality care and the care that they need. So I would look forward. I really appreciate you prioritizing this, because there is important work that needs to be done here to meet our mission at HHS as it relates to IHS, and I would look forward to working with you both through the work we can do at IHS, but then you mentioned legislation. I'd be happy to work with you legislatively if there are things we need to do in that space as well.
Thank you. And very quickly, Ms. Brooks-LaSure, CMS plays a significant role with IHS as a payer, and because of its involvement in accrediting facilities and assessing compliance with quality and safety measures. Over the years, multiple facilities in my state have lost or were in jeopardy of losing CMS accreditation because of quality issues. What can we do to improve coordination between IHS and CMS and holding facilities accountable for delivering the highest quality of care?
This is a critical issue, and we have to maintain our commitment as the government to work with Indian populations to make sure they're getting the care that they need. I pledge to work with my colleague to make sure that IHS and CMS are coordinating well, and whether it means that CMS needs to provide technical assistance or take other steps, we'll work with you on this.
Thank you, and thank you, Mr. Chairman. And I would just point out one thing I forgot to mention: North Dakota is also a state that's impacted by all these 340B issues. The regional systems that serve South Dakota also serve North Dakota. Thank you.
Thank you, Senator Thune. Senator Whitehouse.
Thank you, Chairman. Welcome to both of you. have 5 minutes to get through 4 questions, so I'm trying to go quickly. Macro and micro. We have trillions of dollars in debt. 2024 is the first insolvency date of Medicare. And as my perennial graph that I think I've shown you before shows, something happened in here that has saved $6 trillion in federal health care spending predicted in the next decade. I think that what happened in here was delivery system reform. And I am asking that both of you agree that this needs to be a top priority for CMS and HHS. Figure out why that happened, to do more of it. Do you agree?
Yes, Senator. I think that delivery system reform is critical for addressing costs, making sure that we're delivering the care that people need, and CMS will continue to look at its authority through the Innovation Center and through the Medicaid program to continue to work on these issues.
I would echo my colleague and would just suggest that it is also the opportunity to put patients at the center of care as we're thinking about this.
Second point, ACOs. We have a lot of really wonderful ACOs. Rhode Island has 2 of the best performing ACOs in the country. And it has been a constant battle to defend the ACOs from you guys trying to pick their pockets before they really get the reward of the investment that they have made. We're seeing ACO participation actually shrinking rather than growing. Would you help me make sure that the ACO lead dogs who are crafting the new model of care actually get supported and encouraged so that that model of care can propagate?
Senator, you have raised such an important issue, which is that we want to make sure that our private sector stakeholders want to continue to innovate. And if confirmed, I will work with you to make sure that our incentives continue to keep innovators wanting to innovate.
Thank you. We have a Rhode Island project on end-of-life care that will ask for waivers of some Medicare payment regulations that are frankly stupid when they're applied to this population. And I've been working on this now for 8 years, and always as we get close to administration change or personnel change or something, I am determined to get a CMMI waiver that makes this happen. You promise you will work with me to help me get this CMMI pilot and those requisite waivers.
If confirmed, Senator, I am happy to understand this demo better and work with you on what we can do here.
Yeah, I come into this boiling with frustration because it's 8 years of work and it always falls off the ledge when there's a change in the executive branch, and I am going to get this done. And the last thing is we are working with medication-assisted treatment. We've seen telehealth be very helpful in this space. There is an ongoing conversation about the extent to which that telehealth engagement needs to be video conference and when it can be audio conference with people who don't have a home to go to, people who are in perilous circumstances of various kinds. The audio can be actually necessary and it's often intermediated by very responsible groups that are serving that population. Can you help me understand the best practices for the video versus audio and have somebody from HHS or CMS assigned to give me advice on where we should be fighting to draw that line? When is audio okay? When do you actually need it to be video for medication-assisted treatment telehealth?
Yes, Senator, this is a critical issue. So many underserved areas struggle with this distinction, and as much as we've seen telehealth improve care for some, we need to make sure that it really is available for all. Happy to talk to you and learn more about
I'll
this.
wrap up with the observation that a lot of people, including our people in our national security establishment, said the biggest danger to America actually are debt and deficits. And then they go on to say, and the biggest danger in our debt and deficit area is this explosion of healthcare expense. So that makes this question of how you draw down without taking the benefits away from people by making this really turgid system clear, fast, and efficient, and provide people care early so they don't end up in expensive care. That to me is just such an important priority. I hope you will see it that way. You may end up being the most important people in government of all this, I
Thank you, Senator Whitehouse. Senator Hassan.
Well, thank you, Mr. Chair, and I want to thank you and our ranking member for this hearing, and to our nominees. Thank you both for being here, for your willingness to serve, for the service you've already provided to your country and your state, and to your families, too. And I want to associate myself with everything that Senator Whitehouse just asked you about, and will just say that I know Senator Bennett asked about the implementation of surprise medical bills. I think that the passage of that legislation to end that practice was an example of really patient-focused policymaking, right? And so I would look forward to working with you both as we implement that provision and find further ways to really look at our healthcare system from the patient's perspective. And I appreciate very much your willingness to do that. Ms. Palm, I wanted to start with a question to you. As you know, the COVID-19 pandemic has exacerbated the ongoing substance use disorder crisis in the country. It's critical that Congress and HHS work together to ensure that states receive the funding that they need to support continued access to substance use disorder treatment and services. Over the past several years, state opioid response grant funding has allowed New Hampshire to dramatically expand access to opioid use disorder treatment and services for granted staters. But under the current funding formula, a significant portion of New Hampshire's state opioid response grant funding is now at risk. I'm working to ensure that states like New Hampshire do not face dramatic funding cuts that would devastate opioid use disorder treatment programs. Will you commit, Ms. Palm, to working with Congress to ensure that states do not face dramatic cuts in state opioid response grant funding?
Senator, I'm so grateful for your leadership on this issue, and considering what we've seen with the pandemic, we were making such good progress, and we've got to double down, and it's critical that states have the funding that they need to continue to provide treatment for opioid use disorders.
Thank you very much. Ms. Brooks-LaSure, I want to turn to you, and I just want to say that I have two of the most eloquent colleagues in the world, Senators Menendez and Casey, when it comes to talking about home and community-based services. So I'll associate myself with their comments about the importance of it. We know how important it is to individuals and families to have the choice to get their long-term care at home among familiar faces in their community, and a chance to really interact with their loved ones and control their care that way. But I want to drill down on a couple of things. Unfortunately, many individuals who receive care in home and community-based settings have really faced unique challenges accessing, for instance, COVID-19 vaccines. And we know that home health workers have struggled to access the personal protective equipment and COVID-19 testing that they need to do their jobs safely. Just as we saw other disparities really highlighted by the pandemic, this disparity in terms of being either a home health care patient or a home health care worker has really been exacerbated too. So following up on the commitment you made to Senators Menendez and Casey, as CMS administrator, how would you work with states to better support home health care workers and individuals who receive home and community-based care during the COVID-19 pandemic?
Thank you, Senator. This is, as you've raised and the other senators have raised, is such a critical issue. We want to make sure that people are in the setting that makes the most sense for them, and if confirmed, you certainly have my commitment to make sure that CMS is doing everything it can do, whether it's approving waivers or working with states to address issues. And I'd love to follow up with you on this particular point.
Well, I would look forward to that as well, because it continues to be a really serious issue. I have one more question, and it's to Ms. Palm. As the Secretary of the Wisconsin Department of Health Services, you emphasize the importance of health data infrastructure in expanding access to COVID-19 testing. With the continued emergence of COVID-19 variants, ongoing surveillance and health data exchange will be essential for tracking emerging variants and mitigating community spread. If confirmed, how will you leverage the tools at CMS or throughout the department to incentivize health data modernization and improve data exchange?
It's such an important question. I think more broadly, our data infrastructure, our technology, our modernization of the way we think about surveillance and data is critical, and it's a place where HHS can and should help be a leader so that we are learning the lessons of what our data infrastructure could do and couldn't do, what we needed it to do, where we could partner with the private sector to really maximize our ability to understand community spread in the example you gave, and how that helps us get in front of the next surge or the next community who is facing an outbreak. And so there's a lot of opportunity there, and I think we really have to be focused, learn the lessons, and drive that into the next iteration of how we work on data and the transparency of that data moving forward.
Thank you very much. I look forward to working with you on that. Thank you, Mr. Chair.
I thank my colleague. Next is Senator Daines.
Thank you, Mr. Chairman. Due to the open border policies of this administration, we're experiencing a public health and, sadly, humanitarian crisis at our southern border. I saw it firsthand myself. Other senators on this committee, in fact, were there as well, including Senator Cornyn, just a few weeks ago. We had a chance to talk face-to-face with the Border Patrol agents who were overwhelmed by the influx of migrants at the border. The Donna, Texas facility has a capacity of 1,000. With COVID, they've reduced that number to 250. There were 4,200 migrants in that facility the day we visited here just about 2.5 weeks ago. If confirmed, you will help oversee the agency that handles care for unaccompanied children. Ms. Palm, do you think the current situation at the southern border is a crisis?
Senator, I'm so grateful that you raised this. This is one of the most pressing issues that HHS is working on right now, and should I be fortunate enough to be confirmed, I look forward to being part of helping get these children through the system and placed in safe places with sponsors as quickly as possible.
Do you think it's a crisis?
I think it's a very urgent need. And
have you seen it?
I have not been to the border,
Yeah,
sir.
have you seen the photos of the children? These overcrowded facilities with no COVID protocols in place. You know, I'm from a northern border state. The northern border is still virtually shut down. The southern border had 4,200. Many of them were children in this facility with a 250-person capacity. A high percentage of COVID transmission going on, high positive COVID test rates. Have you seen those photos with really no COVID protocols in place?
I have, Senator, and I can tell you as a social worker, the care and safety of those kids it has to be our top priority at HHS, and if I'm confirmed, I certainly will.
And you're aware of what's going on across the Mexican desert with the cartels and the coyotes, the human trafficking, the abuse of these children that's going on as a result of creating an incentive by the Biden administration for them to make that dangerous journey, give their life savings away to the cartels to come across illegally?
I think one of the most important parts of the process for us in placing these children with sponsors is that screening to make sure that those children are going to safe homes, trusted homes, so that human trafficking and those abuse issues are screened out.
Yeah, but once you get across the border, the trafficking issues and the abuse issues have already occurred. I mean, this becomes a question: how do we prevent that and, frankly, stop it?
Senator, I know that there are my colleagues across the administration who are looking at the broader issues at play here, at the root causes and other issues. What I can tell you is, should I be confirmed, our focus at HHS will be on the safety of those children, placement in safe homes, and finding efficiencies in the system so that we're moving them quickly.
Thank you. And do you think that the vice president, who the president has put in charge of resolving the issues in the southern border, do you think she should be visiting to see firsthand what's happening on the southern border and witness the conditions that we all saw here 2.5 weeks ago?
I think the vice president has been tapped with a great challenge, and I'm sure she's doing everything she needs to do. We're just curious. Why wouldn't she go down and see this firsthand? The president has given her explicit responsibilities, and that was 20 days ago, and she has yet
to show any interest in actually visiting the southern border. Hasn't shown up.
Senator, what I can tell you is, should I be confirmed, I really want to emphasize the priority that we have on placing those children as safely and quickly as possible.
Throughout the pandemic, assisted living providers in my home state have cared for over 6,000 vulnerable Montanans, many who are living with Alzheimer's or some form of dementia. Due to PPE needs, workforce needs, occupancy deadlines, I continue to hear that many of these providers have suffered millions in losses throughout the pandemic and will struggle to sustain their operations without financial relief. There's about $23 billion remaining in the Provider Relief Fund to help support our healthcare heroes who are on the front line for COVID response. I've urged Secretary Becerra to distribute more of the remaining PRF to assisted living facilities and other senior care centers. Ms. Palm, would you support that kind of request?
Yeah, to your point, our frontline healthcare workers have borne the brunt of this pandemic. When I was in Wisconsin, we added additional dollars to what the feds were providing to help ease the workload and the burden that they were facing.
Thank you. I want one final question here for Ms. Brooks-LaSure. I founded this pro-life caucus in the United States Senate. I'm deeply committed to protecting our most vulnerable, and that is the unborn. That's why I was troubled to see the Democrats' $1.9 trillion, quote, rescue package included taxpayer funding of abortion in numerous provisions, including through Obamacare. If confirmed, how will you ensure compliance with separate billing requirements for abortion under Section 1303 of Obamacare?
Senator Daines, I will, if confirmed as CMS administrator, absolutely follow the law. And Congress sets that, and whatever the requirements are, it will meet those.
And more specifically, will you require recipients of abortion covering plans with zero cost premiums due to the expanded tax credits to pay the required abortion coverage surcharge of at least $1 a month under the law?
Senator, I will follow the law. So if that is the law, I will move forward with whatever you as Congress have passed for me to do. That's my responsibility.
Thank you.
Thank you, Senator Daines. Next is Senator Cornyn.
Ms. Palm, I think the chairman will back me up on this. China has risen to the top of everybody's agenda from out of concerns about cyber security, cyber attacks, stealing intellectual property, espionage, and obviously with vast national security implications. So I will ask you some specific questions in writing later on, but I want to follow up on some of the things that Senator Daines raised because it has such a dramatic impact on my state and the country. So you would, if confirmed, you would oversee the Office of Refugee Resettlement, correct?
Yes, as part of the Administration for Children and Families, yes.
And you mentioned that your goal would be to place these children, unaccompanied children, with sponsors as soon as you could.
Yeah, our mission is to find the sponsors, the families, the relatives to care for these kids while their immigration processes are proceeding.
And after you've placed them with sponsors, is the responsibility of the Office of Refugee Resettlement finished?
As I understand it, Senator, yes.
Which government agency monitors the welfare of these children once they're placed with sponsors? Is there any government agency you're aware of that has that responsibility?
It's my understanding, and I'm happy to follow up, that if there are concerns, once they're placed, state child welfare agencies can become involved in those situations.
Are you aware of the fact that roughly 18% of the wellness checks, telephone calls made to the sponsor's telephone number, go unanswered?
I did not know that, sir.
Are you aware of the investigation of the Permanent Subcommittee on Investigations of the Homeland Security and Governmental Affairs Committee that revealed that some unaccompanied children, once placed with sponsors, I believe in Ohio, were put into a forced labor condition? Had you heard of that?
I had heard of that, sir, yes.
So do you share my concern for the welfare of these children once they're placed in placed with these sponsors who may not even be American citizens, who may not even be related to the child?
Senator, our mission at HHS is the safety and welfare of those children while they are in our custody, and it is our job to screen those sponsors before placement, and should I be confirmed, I certainly am committed to doing that work.
Well, after they've been placed with the sponsors, who's supposed to protect these children?
Senator, as I mentioned, it's my understanding that if there are concerns beyond the placement, our placement and the transfer of custody to those sponsors, that the child welfare agencies may get involved.
So there may or may not be a report to the child welfare agencies if these children are put into a forced labor situation, or if they're being trafficked for sex, or they're being recruited into gangs. We're supposed to wait on a report from somebody that alerts the child welfare system. Is that correct?
Senator, it's my understanding that if there are concerns post-placement by HHS, that child welfare agencies may become involved.
Well, let's talk about while these children are still in the custody of HHS and the Office of Refugee Resettlement. Last week, my Governor Abbott, sent a letter to Vice President Harris with regard to complaints of sexual assault while young children, I think they're all males, were located at the Joe Freeman Coliseum in San Antonio in an HHS facility. The complaints outline multiple allegations involving sexual assault, a shortage of staff to supervise the children, and reports that the children were not receiving enough food. There were also complaints that the children who have been exposed to COVID were not properly isolated from other children who were had not been exposed. Obviously, these allegations, if true, are extremely disturbing. What steps would you take, if confirmed, to address these sort of allegations?
Senator, these are serious allegations and certainly ones that I take seriously. Should I be confirmed, I think there are a couple of things here from my experience previously, but also my priorities moving forward. There is a zero tolerance policy for abuse in HHS facilities. There is an internal investigation, and because they are mandatory reporters, there also is an external investigation that comes forward. Staff are removed from the facility pending that investigation, and that speaks to the seriousness with which HHS takes allegations around abuse of children in our care. As it relates to COVID protocols, obviously that is a critical part of reducing the spread of COVID, and it's my understanding that CDC is both providing assistance in the development of those protocols, but also that there are CDC folks on the ground at our facilities to help with implementation and to help make sure that what is necessary is being done. But if there are concerns that that's not happening, I would look forward to hearing about them and working with you to make sure that those COVID protocols are in place and implemented.
The time of my colleagues expired, and we still have other senators waiting. Senator Warner.
Thank you, Mr. Chairman. And again, Ms. Brooks-LaSure and Ms. Palm, thank you for your willingness to serve. Got a quick series of questions. Over the past decade, 100 rural hospitals have closed. We've seen that 3 of those in my state of Virginia. Obviously, the pandemic has particularly hit rural communities extra hard, rural hospitals extra hard. It's no coincidence that the vast majority of these hospital closures occurred in areas with the lowest Medicare wage index rates. In Virginia, for example, I've been working for 3 or 4 years in one of our most rural far southwest counties, Lee County, to get a hospital facility reopened. And they've told me point blank, and we are on the path to getting it reopened, that fixing the Medicare area wage index would be a huge step in the right direction. To help solve this problem, we've got bipartisan legislation, the Save Rural Hospitals Act of 2021 with Senators Blackburn, Cornyn, and Warnock, which would establish a reasonable national minimum Medicare wage index of 0.85, which would increase Medicare payments for rural hospitals in 22 states. Ms. Brooks-LaSure and Ms. Palm, obviously both HHS and CMS would play incredibly important role. I'd like you to both pledge to work with Congress, if you're confirmed, to support rural hospitals by addressing the problem in the Medicare area wage system, and any other comments you might have specifically on how we can guarantee the viability of long-term of our rural healthcare systems.
Thank you, Senator Warner, for your leadership, and for other members of this committee who I know very much care about your rural hospitals, which are, in so many areas, backbones of their communities, and their issues can be different across the different states. We will absolutely work with you to make sure that we are supporting rural hospitals in the way that is appropriate, and want to work with you on this topic.
And specifically on the rubber hits the road on the Medicare area wage system, and you'll work with us on that issue specifically as well.
Certainly.
Ms. Palm?
I'd look forward to working with you, Senator, on this issue.
Both very, very important. And again, I think you're going to find a broad-based bipartisan support for changing the ratio. The 0.85 is where we've suggested, and again, look forward to working with the both on that. I want to raise another issue, which is the question around diabetes and diabetes education. I think we all know, 1 in 3 Americans have diabetes. My home in Virginia, we got 631,000 Virginians who've got diabetes. To try to educate those individuals, lifestyle changes has been a bit of a challenge. The National Diabetes Prevention Program, which again, CMS has worked with, has shown, I think, great results. The problem has been that, example, in Virginia, we only have 1 in-person educator for the whole state. So with COVID coming, we've been able to show through telehealth that this is a much more efficient delivery model, oftentimes, again, to the rural communities we were just talking about. So I've got, again, legislation bipartisan with Senator Scott from South Carolina that would allow a virtual platform to be used. I don't know if this has come to your attention, Ms. Brooks-LaSure, but again, for both potential nominees, I would hope you'd be willing to take some of the lessons learned from COVID and the delivery of telehealth, particularly on the education side with diabetes. I think this may be one of the areas where we've got a better solution set now, and my hope would be that we could make that permanent.
Thank you, Senator Warner. I certainly have heard across even this discussion of how important telehealth is, and what a great example of a clear area where it's been helpful. Really want to work with you and all the members of this committee to see what we can do, certainly if confirmed administratively, as well as where we might need congressional help.
Ms. Palm?
I would welcome the opportunity. I think we learned in Wisconsin that these flexibilities and the opportunity to be creative in this space provided us learnings and places where we ought to maintain those flexibilities, and I would look forward to working with you.
Mr. Chairman, this is an area I hope I could work with you on as well. I think that getting this diabetes education on a virtual platform really makes a great deal of sense. Thank you, Mr. Chairman.
Absolutely, Senator Warner. I think it is hugely important. Thank you. Our next speaker is Senator Cortez Masto.
Thank you. Congratulations to both of you. Let me just say, in nearly every conversation I have with Nevadans about the pandemic, they mention the toll COVID-19 has taken on mental health and wellness, from students experiencing trauma to isolated seniors to communities of color who've been hardest hit and families experiencing severe economic hardship. No one has been spared in Nevada, and similarly across the country. In my view, addressing these impacts should be at the top of both of your lists. So let me start with, there's been a lot of discussion about telehealth and telemedicine. Count me in as something that I have seen in my state that should be permanent. It has brought essential service into our underserved communities. But one thing I do want to add, Ms. LaSure, is that utilization of telehealth services via telephone without any video is just as important. So I hope as we look at making this a permanent infrastructure, we recognize the benefits of both, whether it's video or just a telephone working with a patient, because that has brought essential services into my communities as well. And I just want to put that on your radar. Another area I want to focus on that unfortunately we've seen high suicide rates in Southern Nevada from some of our students. And recently I wrote a letter to Secretary Becerra and Secretary Cardona about my concerns over students' mental health and behavioral health. And I asked the secretaries to work together to ensure that schools are welcoming kids back to classrooms and they have guidance and best practices at their fingertips that incorporate the wealth of knowledge at HHS on dealing with youth mental health. So let me ask Ms. Palm, as the COO of HHS, how will you work to ensure that we're leveraging all of the expertise at the department, from ACF's work with kids in the child welfare system to SAMHSA's experiencing and providing trauma-informed care, to make sure that we're spending the American Rescue Plan resources as effectively as possible?
I really appreciate the question, Senator, and appreciate your leadership in this space. I think, as we talked about when we met and here today, if I'm fortunate enough to be confirmed, I think one of the places where the Deputy Secretary's office has a real opportunity is in making sure that the whole is greater than the sum of its parts, that we really are leveraging the assets and the expertise of the various programs in the department to really put the people that we serve, the American people, at the center of what we do and the programs that we implement. And so whether it's kids' mental health or other issues, we have a real opportunity, and I certainly would look forward to working with you on this issue and others where our coordination and our ability to work together really does better serve the people of this country.
Thank you. And staying on the same theme of behavioral health, crisis services. So last year, SAMHSA released national guidelines for behavioral health crisis care. This playbook is a product of years of work by the agency and draws from innovative projects in communities across the country that are going above and beyond to meet the needs of individuals experiencing behavioral health services. This tool is so important because it paints a picture of how we can build a sustainable continuum of crisis services that we do not have in Nevada. And similarly, I'm hearing from some colleagues across the country. I've started working with Senator Cornyn on legislation that would help states stand up crisis services and make them sustainable by integrating them into both public and commercial insurance plans. So Ms. Brooks-LaSure, these guidelines are a product of SAMHSA, but CMS will play an integral role in expanding crisis services to patients across the country. Can you speak to what you see as the need for behavioral health crisis services and how you would work with SAMHSA to make sure that those needs are met?
Thank you for raising this issue and for your leadership in this area as we've been talking today. And then what we've seen across our country in terms of mental health, we had an issue before COVID, and COVID has absolutely had such an effect on so many individuals, and particularly students, as you raise and point out. One of the things that, if confirmed, I want to make sure is that CMS is really integrating very closely with the other parts of HHS, so with my colleagues. States in the Medicaid program have a very important role in behavioral health, and many of them are engaging and working in this area. I think certainly in the Medicaid program and others, we want CMS to integrate with SAMHSA to make sure we are tackling this issue holistically as opposed to one part of the agency.
Thank you. And I know my time is up. I just want to say, as you've heard from the discussion, this is such an important topic by all of my colleagues. We've talked about this in a bipartisan way. As you can imagine, we look forward to working with you to really bring additional resources that are necessary to address behavioral health needs across this country. Thank you again, and congratulations on your nominations.
Thank you.
I thank my colleagues. Senator Warren is next.
Thank you, Mr. Chairman, and congratulations to our nominees. It's no secret that our health insurance system, even in the best of times, leaves millions of people without the coverage that they need. But because most Americans still depend on their jobs to provide health coverage, our system performs even worse in a crisis like the one we're now living through. Heading into 2020, nearly 30 million people were uninsured. Then when the coronavirus hit, unemployment spiked, and up to 3 million more people lost their employer-based insurance. Now, President Biden has promised to expand health coverage, and public programs like Medicare that provide high-quality care at low cost will be the backbone of that expansion, not for-profit insurers that will find any opportunity to shift costs to patients while they line their own pockets. So, Ms. Brooks-LaSure, you've testified previously about the popularity of the Medicare program. Americans age 65 and up, and some people with disabilities are eligible for Medicare right now, but there are a lot of people, many just below the eligibility age, who struggle to get high quality, affordable care through private insurance. Can you just say a word about what are the challenges facing older Americans who may want Medicare, but they haven't hit their 65th birthday yet?
Thank you, Senator Warren, for your leadership in making sure that policymakers continue to focus on making sure coverage is affordable in this country. The Affordable Care Act was such an incredible, important first step in making sure that people had affordable care options. The Congress has just passed the American Rescue Plan. Thank you for that, which is making such a difference to people on the ground right now who, as a result of the COVID pandemic, may be struggling to pay for their health insurance. Right below the Medicare eligible age can be an incredible challenge for people if they don't have affordable employer-sponsored insurance. In many states, coverage through the marketplaces is available to them, and we need to continue to work to make sure that we have affordable options available for that population in particular, as they may be wanting to make decisions about retirement, making decisions about job changes at that point in their lives.
Right. So we have this group of Americans who aren't quite old enough yet for Medicare, but who are sometimes struggling to access health care right now during the time in their lives when they start to need health care coverage the most. As a candidate, President Biden promised to help this group of Americans by lowering the age of Medicare eligibility to 60 years old. And doing so would expand Medicare coverage to roughly 23 million people. Ms. Brooks-LaSure, analysts have shown that lowering the Medicare eligibility age to 60 could ensure nearly 2 million previously uninsured people would get coverage and would help reduce premiums for the current Medicare population because it would add a younger, healthier population to the Medicare risk pool, benefiting the health system overall. Is that correct?
I'm not familiar with that particular study. I do know that the population you're talking about is absolutely one that, as I've worked with states where eligibility for various programs could be higher, and we need to make sure that population has.
Well, let me just ask it slightly differently. I understand if you don't know this particular study, but the general principle makes sense. When we have fewer uninsured people and when healthier younger people join risk pools, that's a good thing, right?
Yes, it is a good thing when healthier younger people join risk pools.
And more people get coverage. So, Ms. Brooks-LaSure, do you agree with President Biden that lowering the Medicare eligibility age could strengthen healthcare coverage in America?
I think that the president has outlined several important policies, including, as you said, the lowering the Medicare age, and if confirmed, I will work to implement the policies of the administration.
Good. And I appreciate your answer. I have to tell you, lowering the Medicare eligibility age to expand coverage and lower costs is a no-brainer. I know President Biden has talked about dropping the Medicare age from 65 to 60, but frankly, I think we should go even further. People need low-cost health care option, particularly as they get older and need more health care. Dropping the age to 60 could expand Medicare for 23 million people, but dropping the age to 55 could expand it for an additional 14 million people. And doing so has the potential to lower premiums in the Medicare program and, depending on how we structure it, lower premiums for private health insurance too. So we have this opportunity to expand Medicare coverage to tens of millions of Americans, and we can't waste it. We need to get this done. Thank you, Mr. Chairman.
Thank you, Senator Warren. And Senator Warren is raising an important point. I was director of the Gray Panthers for about 7 years before I was elected to Congress. And one of the things we always talked about is Medicare, when it began in 1965, was just half a loaf. It didn't cover so many crucial needs, dental care, for example, which we've seen during the pandemic be a particularly urgent priority. So I think these are critical issues that we're going to be digging into. I've got a couple more questions, and then we'll wrap up. On the chronic care question, apropos again to how Medicare has changed. Back in those Gray Panther days, I taught gerontology as well. First question on every exam I gave was, what was the difference between Medicare Part A and Medicare Part B? Because that was it. You had hospitals, you had doctors, and you were basically dealing with acute care. That isn't it anymore. Now the program is overwhelmingly about chronic illness, and it is increasingly headed that way. So I've got a very specific question. Our bill in 2017 finally put a stake in the ground that we were going to update the Medicare guarantee. We did fairly well in some key pieces. Telehealth would be one. The Trump administration, your predecessor, Ms. LaSure Brooks, didn't do much, but at least we got that position, Medicare Advantage. But my question to you is, what are the next steps in your view? Because it seems to me that one of the next crucial priorities for chronic care is doing more to bring traditional Medicare, which still covers millions and millions of people, into this circle of better care for what is overwhelmingly going to be the future of the program. What are your thoughts on that?
Thank you, Chairman Wyden, for your leadership in passing the Chronic Care Act. And I know that there's been so much analysis on how effective and helpful that is, including an article by the late Robert Pear. And Medicare Advantage has been able to take advantage of the legislation and the work that you've passed. I think, as Senator Brown mentioned, it's critically important that we bring some of the innovations and advantages to traditional fee-for-service and traditional Medicare, and whether that's something that we can, if confirmed, look at administratively, or whether that's something we need to come back to Congress for. I am happy to work with you on this topic.
Again, I put this in the context, not just if you're confirmed, when you're confirmed, because we are deeply committed to that. I'd very much like you all to assign some staff from the department to work with us. We'll work on a bipartisan basis. Then Chairman Hatch and I did that when we wrote the the original bill. But I just think we've got to do more to bring traditional Medicare into the update of what is, I think, to the American people, a guarantee of Medicare. Now, a quick point about prescription drugs, because you've heard this back and forth and the like. I think we know why this is such an acutely important issue to millions of people. They just feel like they're getting mugged at the pharmacy counter. I mean, insulin prices up 12-fold in a period of time that wasn't very long. Drugs not 12 times better. I mean, it's just plain old price gouging. So I want you to know that what I'm in favor of is a policy that has Medicare negotiate on behalf of the more than 60 million Medicare beneficiaries in order to get them a better deal. So that's piece number one. And the second piece, which we focused on here in the Finance Committee, is when Big Pharma is price gouging, they're going to lose subsidies. You know, they get subsidies from the federal government. They price gouge on insulin. They're going to lose some of those subsidies. And so as you all in the administration, when confirmed, debate those issues, I wanted you to hear, to me, we ought to be pursuing both policies. Letting Medicare negotiate, because everybody tries to negotiate, it's just common sense, and we cut subsidies when there's price gouging. That way we'll produce more savings for the seniors and more savings for taxpayers. Last point, just to send you all off formally, I consider you both to be eminently qualified, and I think people who review this hearing and look at the record will see considerable bipartisanship. And Ms. Palm, I noted that if confirmed, you would advance the common ground agenda. That's pretty conciliatory language. And Ms. Brooks-LaSure, you indicated that you'd work with finance members on several bipartisan issues like the telehealth question and the 1332 waivers, which I talked about at some length. We don't need to do that again, but I appreciated your saying that that would be a priority for you when confirmed in terms of getting the guidance out. So we have had a long hearing today. I just want members to know I'm going to support these two nominees strongly. The deadline for senators to submit their questions for the record is 5 p.m. Friday, April 16th. And with that, the Finance Committee is adjourned.